So when we talk about our cardiovascular health, there's three main risk factors that we like to look at. The first one being hypertension, or this is high blood pressure. So when we have a lot of pressure in our vessels in our body, then that can lead to an increased risk of heart attacks and even strokes. And that increased blood pressure can be a result of oxidation or plaquing within those arteries from the foods we're eating or the lack of exercise, but it can also be caused by stress. When we're stressed, our body goes into a sympathetic response, which means our muscles are going to tighten up around those blood vessels, causing more pressure. The second thing we look at is the resting pulse. So this is how many times your heart beats in a minute. If you have a really strong heart, then it doesn't have to beat as much to pump the same amount of blood through your body. Well, when you have a weak heart, then your heart has to beat more, which means it's going to be less efficient to pump that blood. And so your heart is a muscle, maybe the most important muscle in your body. So in order to make that muscle stronger, you've got to exercise it, okay? And one of the best forms of exercise to increase the strength of the heart is doing HIIT training or high intensity interval training. And then the third thing is belly fat or visceral fat. So when we have belly fat, that releases a lot of chemicals in our body, a lot of inflammation in our body. And chronic inflammation will lead to an increased risk of cardiovascular problems. So these are three risk factors that we like to address with our patients to help our patients live a more optimal lifestyle.